Hi guys, good morning. So today we are going to start with another unit of general medicine, that is the disorders of the nervous system. In this, first we are going to discuss about the meningitis. So basically, what is meningitis? It is an inflammation of the para-arachnoid and the fluid contained in the space. Fine. Now meningitis, it is of two types, the infective one and the non-infective. The infective is further divided into acute, chronic, recurrent, and acute is further divided into bacterial, viral and fungal. While the non-infective meningitis, it is divided into two parts, the malignant disease and the inflammatory disease. So the malignant disease, it is due to the lung cancer, breast cancer, leukemia and lymphoma. While the inflammatory, it is due to sarcoidosis and the systemic lupus erythematosus, that is SLE. Now first we are talking about the bacterial meningitis. So in this, the bacteriology of the meningitis, it is very important. So the commonest cause in neonates and infants, it is gram-negative bacilli, which is E. coli and Proteus, group B streptococcus or streptococci, and Listeria monocytogenes. In the children, the commonest cause is Haemophilus influenza. Fine. And in the adults and in the adolescent, the commonest cause is Streptococcus pneumoniae, and also the Mycobacterium tuberculosis. And in the old age and in the immunocompromised patient, the most common cause is the Listeria monocytogenes, and also the gram-negative bacilli, which is the Klebsiella and E. coli Proteus. Fine, very important. And in the fungal meningitis, the most commonest cause is the Cryptococcus neoformans. Important. Fine. So after this, let's discuss the signs and the symptoms of the meningitis. So the symptoms are fever, vomiting, headache, malaise, convulsions in the children, pain in neck, stiffness of neck and back, that is impairment of consciousness, confusion, delirium and coma. Fine. And the signs are the head retraction. It is the common in infants and in children. Next is the neck rigidity. It is the bending of the neck produces the pain and the spasm of the neck muscle, or it may be difficult to bend the neck. Fine. Next are the positive sign or the Kernick sign. So the positive signs is, or the Kernick sign, it is the flexion of the hip joint with the bent knees on one side, sudden extension of the knees on the same side produces the flexion of the hip and the knee of the other side. So this sign may not be elicitable in an unconscious patient. Second sign is the Brudzinski sign. So it may be positive if the patient is conscious. Next is the papilledema and the cranial nerve palsies. So these are the commonest signs and the symptoms. Now coming on to the investigations. So in this, the TLC and the DLC, it increased, or CSF pressure is also elevated, protein content is also elevated, and sugar content is decreased. Coming on to the risk factors of the meningitis. So the risk factors are the adult older than the 60 years are at the higher risk of meningitis. The children younger than 5 years of age, these are also at the greater risk of the meningitis. So people with the alcoholism and with the sickle cell anemia. Fine. Now coming on to the management part. So first, for the pneumococci or the meningococci, so in the children you can give penicillin 3 lakh unit per kg, and in the infants you can give penicillin 1,50,000 units per kg. Fine. Coming on to the treatment for H influenza. So in the neonates you can give the penicillin 300 to 400 mg per kg IV, and in the adults you can give 12 to 18 gram daily. Now coming on to the complications. So the complications, first complication are the neurological defects. It includes the hemiplegia, blindness and deafness. Local fits, other than the neurological defects, there are local fits, permanent brain damage and the mental retardation. Next we are talking about the tuberculous meningitis. So it is a condition which is commonly acquired after the primary infection in the childhood. Coming on to the signs and symptoms. So signs and symptoms are, in the children, the fever, listlessness, lethargy, lack of interest in the surrounding, there is anorexia, vomiting, constipation, headache, convulsions, impairment of consciousness, head retraction, neck rigidity and positive Kernick sign, important. And there is hydrocephalus. Coming on to the signs and symptoms in adults. So there is low grade fever, nausea, anorexia, vomiting, pain in the neck, headache, visual disturbances, impairment of consciousness, cranial nerve palsies, obstructive hydrocephalus and papilloedema, neck rigidity and positive Kernick sign. Fine. Coming on to the treatment of tuberculous meningitis. So you can give prednisolone in 20 to 30 mg daily to prevent the meningeal adhesions. So next is the aseptic meningitis. So it is caused by the virus. It is less serious than the bacterial meningitis. Causes are, the commonest cause is, it is due to ecoviruses or the mump virus. Fine. Other than the ecovirus and the mump virus, the causes are the herpes simplex, HIV and Epstein-Barr virus. Coming on to the clinical features. So there is high grade fever, headache, vomiting, irritability, neck pain and stiffness. So treatment are, you can give analgesic and antipyretic. So coming on to the differential diagnosis of the CSF finding in the meningitis, it is important. First is the gross appearance. So in the pyogenic meningitis, it is turbid. Tubercular meningitis, it is a clear or a straw color cobweb, important, cobweb is seen on standing. And in aseptic meningitis, it is clear. So protein, it is elevated, and in the tuberculosis meningitis it is also elevated, but in the aseptic meningitis it is normal. Coming on to the sugar content. So in the pyogenic meningitis it is markedly reduced. In the tuberculous meningitis it is moderately reduced, while in the aseptic meningitis it is normal. So cells in the pyogenic meningitis, it is more than 1000 cells per cubic mm, mainly the polymorph. While in the tubercular meningitis, the cells are more than 400 cells per cubic mm. It is mostly mononuclear. Fine. While in the aseptic meningitis, it is markedly lymphocytosis. Culture. In this, the pyogenic organism may be isolated, and in the tubercular meningitis, it is difficult to isolate the tubercular bacilli, and in aseptic meningitis, it is not helpful. Now coming on to the fungal meningitis. So it occurs in the patients who are immunocompromised. The commonest cause is Cryptococcus neoformans, and the clinical feature is as similar as that of the tuberculous meningitis, and treatment is amphotericin, which is given intravenously. Fine. So this is all about the meningitis. Fine guys, please go through it once and try to make the notes. Thank you.